Nursing is one of the most rewarding yet demanding professions in healthcare. Nurses are the backbone of hospitals, clinics, and community health services, combining clinical expertise with compassion and patience. Because of the responsibility that comes with caring for patients, nursing interviews are designed to test both technical knowledge and interpersonal skills. Employers want to see that you have the medical expertise, emotional intelligence, and resilience required to thrive in a challenging healthcare environment. When preparing for a nursing interview, it is important to show not only that you understand medical procedures but also that you can comfort patients, work well with colleagues, and adapt to stressful situations. To help you prepare, let's go through some of the most common nursing interview questions. For each one, I'll explain why it's asked, provide a strong way to answer, and finish with a practical tip to improve your response. Question 1. Why did you choose nursing as a career? This is usually one of the first questions, designed to explore your motivation. Answer begins here. I chose nursing because I wanted a career that combines science with compassion. Ever since volunteering at a local hospital in high school, I realized how much of a difference nurses make in people's lives. Seeing patients comforted not just by treatment but by care inspired me to pursue this profession. Nursing allows me to use my skills while making a direct impact on individuals and families. Tip: make your answer personal. Show your genuine passion and commitment to patient care. Question 2. How do you handle stressful situations? Nursing often involves long shifts, emergencies, and high-pressure moments. Interviewers want to know if you can stay calm and effective. Answer begins here. In stressful situations, I prioritize staying calm and focusing on the immediate task. For example, during my clinical rotation, a patient's condition suddenly worsened. Instead of panicking, I quickly notified the doctor, assisted with stabilizing the patient, and kept family members updated. Afterward, I reflected on the situation and noted areas for improvement. Remaining composed helped the team respond effectively. Tip: highlight resilience, teamwork, and the ability to think clearly under pressure. Question 3. Can you describe a time you dealt with a difficult patient? This question reveals empathy, patience, and communication skills. Answer begins here. During my internship, I cared for a patient who was very resistant to taking medications. Instead of insisting, I listened to their concerns, explained the importance of the treatment, and answered their questions patiently. By showing empathy and respect, I gained their trust, and they eventually followed the care plan. Tip: always show empathy in your answer. Explain how you balanced professionalism with compassion. Question 4. How do you prioritize patient care when you have multiple responsibilities? Nurses often juggle many tasks at once, so interviewers want to hear about your organizational skills. Answer begins here. I prioritize based on patient safety and urgency. If one patient requires immediate medical attention, that becomes my focus while ensuring others are monitored. For example, on a busy ward, I first attended to a patient with low oxygen levels while updating another nurse about less urgent cases. Communication and delegation allowed me to ensure all patients were cared for without delays. Tip: emphasize safety, communication, and time management in your response. Question 5. How do you handle working in a team with doctors and other nurses? Healthcare is teamwork driven, and employers want to see if you collaborate well. Answer begins here. I believe effective teamwork is based on respect and clear communication. In my last rotation, I worked with doctors and nurses to manage a patient with complex needs. By updating the team promptly and asking clarifying questions when needed, I helped ensure the care plan was followed smoothly. I value every member's input because healthcare is about collective responsibility. Tip: show humility and collaboration. Avoid portraying yourself as a lone worker. Question 6. What do you consider the most important qualities of a nurse? This helps interviewers see if your values align with nursing ethics. Answer begins here. The most important qualities of a nurse are empathy, attention to detail, patience, and adaptability. Empathy builds trust with patients, attention to detail prevents errors, patience allows for better communication, and adaptability ensures you can handle unexpected challenges in healthcare settings. Tip: connect qualities to patient care, not just to personal strengths. Question 7. How do you handle mistakes at work? Nursing requires accountability, so this question tests honesty and responsibility. Answer begins here. I believe in acknowledging mistakes immediately and taking steps to correct them. For example, once I almost administered the wrong dosage during training. I caught the error before proceeding, reported it to my supervisor, and double-checked the protocol. Since then, I've developed a habit of triple-checking medications. Mistakes are serious, but they're also opportunities to improve. Tip: show honesty and accountability, never try to cover up errors. Question 8. Can you share an example of how you comforted a patient or their family? This question highlights your compassion and emotional support skills. Answer begins here. I once cared for a child undergoing surgery, and the parents were extremely anxious. I took time to explain the process in simple terms and reassured them that the medical team would keep them updated. After surgery, the parents thanked me for easing their fears, which reminded me how important emotional care is alongside medical treatment. Tip: demonstrate empathy and communication. Show how you build trust beyond clinical duties. Question 9. Where do you see yourself in 5 years as a nurse? This helps employers understand your career goals and commitment. Answer begins here. In 5 years, I see myself as an experienced nurse who has developed specialized skills, possibly in critical care. I also want to mentor new nurses and contribute to improving patient care practices in the department. My long-term goal is to continue learning while making a difference in patients' lives. Tip: show ambition but also loyalty. Employers value growth that benefits the organization. Question 10. Why should we hire you as a nurse? This is your chance to summarize your strengths with confidence. Answer begins here. You should hire me because I bring a strong combination of clinical knowledge, compassion, and teamwork skills. I have proven experience handling patient care under pressure while maintaining empathy and professionalism. I am committed to continuous learning and providing the highest quality of care. Tip: end on a confident note. Summarize your top strengths and show enthusiasm. Conclusion: nursing interviews are not just about clinical expertise but also about compassion, teamwork, and adaptability. Employers want to know that you can remain calm under pressure, communicate effectively, and deliver care with empathy. By preparing thoughtful answers and sharing specific experiences, you can highlight both your technical ability and your human touch. When practicing, remember to structure your responses with clear examples, stay confident, and show genuine passion for nursing. With preparation, you'll not only succeed in the interview but also prove that you're ready to make a lasting impact in the nursing profession.